Question number 4. The results of randomized clinical trials testing the efficacy of common medical interventions sometimes fail to blank conclusions that practitioners reach based on their real world observations of patients. While there are several possible reasons for this, one is that practitioners may overlook confounding variables that account for the results they attribute to the interventions in question. Which choice completes the text with the most logical and precise word or phrase? Is it A. Circumvent, B. Corroborate, C. Disseminate, or D. Implement? So here there is a comparison of results of randomized clinical trials testing the efficacy of common medical interventions, and that comparison to the conclusions which practitioners reach based on the real world observation of patients. So there seems to be some difference between them, and then it says that there are several possible reasons. One is that practitioners may overlook confounding variables that account for the results. That means maybe the practitioners are not taking into account all the variables which they attribute to interventions in question. So which should we choose? So if you said B, well done, that is the best answer, because it most logically completes the text's discussion of a relationship between the results of randomized clinical tests of how effective common medical interventions are and the conclusions practitioners reach about such interventions in real-world settings. In this context, corroborate means confirm or support with evidence. The text indicates that one possible explanation for the relationship being discussed is that practitioners may overlook confounding variables, that is, additional factors other than the medical interventions being investigated that affect observed outcomes. This means that practitioners may assume that an outcome is the direct result of a medical intervention when it is actually the result of a combination of factors. Clinical trials take steps to rule out factors other than the one being studied. So if those extra factors are actually having an effect on real-world outcomes, the trials are likely to produce conclusions different from those practitioners reach in their real-world observations. So in other words, clinical trials may fail to corroborate practitioners' conclusions. So it may be not possible to confirm between clinical trials and conclusions that practitioners reach. So that is the best answer. A is incorrect, that is circumvent, because it wouldn't make sense to say that the results of clinical trials could circumvent or find a way around or bypass conclusions practitioners reach in real-world scenarios with patients. It's possible that researchers conducting the trials might avoid engaging with practitioners' conclusions, but findings from a study can't choose to get around something. Choice C, disseminate, is incorrect because it wouldn't make sense to say that the results of clinical trials could disseminate or spread widely. Clinical trials could disseminate or spread widely conclusions practitioners reach in real-world scenarios with patients. The researchers conducting the trials might choose to draw attention to practitioners' conclusions, but findings from a study can't spread anything. Then choice D, implement, is incorrect because it wouldn't make sense to say that the results of clinical trials could implement or put into effect conclusions practitioners reach in real-world scenarios with patients. The researchers conducting the trials might consider practitioners' conclusions, but findings from a study can't put anything into effect. So